Good morning, everyone, and welcome to this wonderful morning with Dr. Murli Bharadwaj. Every day, we discuss 100 questions as a mock test, and in the next 100 days, we finish the most essential 10,000 questions that are must for you to win the race called NEETPG 2024. Thank you all. This is a wonderful early morning waiting outside. And we are all very happy to study and start the day with the test discussion every day. So, can the online students can punch whether the voice is loud and clear for all of you? Can you kindly punch? Rahul, Rajesh, and many more who are all online, can you please punch? Is the voice loud and clear for all of you? Now, today we start with anatomy, the test one of anatomy. Uh, Great. Thank you, Rahul, for the feedback that the voice is loud and clear for all of you. Good. So I hope all of you are having the question paper so that it is very handy so that you solve it every day. I give it as a PDF beforehand. Now, a 12-year-old boy is diagnosed with upper brachial plexus injury after falling from the tree. Which muscle leads to the abduction of the arm at the shoulder? All of you know we will be able to abduct the arm because of the deltoid and supraspinatus. Whenever there is any musculocutaneous nerve injury, musculocutaneous supplies biceps brachii. So that is the reason any biceps brachii weakness will lead to injury, will lead to weakness of the flexion of the forearm at the elbow. So what are the two functions of biceps, doctor? One is it causes the flexion at the elbow. Other is it is also the supinator. It is also the supinator of the forearm. So whenever you are having the elbow in the flexed position, biceps is the supinator. Whenever you have the elbow in the extended position, then it is the supinator which is supplied by the radial nerve, which is the supinator. Don't forget. In elbow, whenever elbow is in flexion, the supinator of the forearm is the biceps. You yourself can test that. Whereas, whenever your elbow is in extended position, then supinator muscle in the forearm is the supinator. And the supinator muscle is supplied by the radial nerve, whereas the biceps is supplied by musculocutaneous nerve. That is the fundamental difference which you need to appreciate. A 22-year-old man is brought with a knife injury in the axilla. You're suspecting lower brachial plexus injury. All of you need to remember everything about Erb's palsy, Klumpke's palsy. One of the favorite questions of the NEETPG examiner. So, lower brachial plexus involves C7, C8, T1, which are all the root value for the ulnar nerve, is what you have to remember. 18-year-old is in axillary type crutches. So, what is called as crutch palsy, radial nerve injury is called crutch palsy. Mid shaft humerus, what will happen? Whenever the mid shaft is injured, then the radial nerve is injured, and the radial nerve innervates the posterior compartment, which contain the extensors muscles at the wrist. You'll get the wrist drop in crutch palsy. Wrist drop whenever mid shaft of the humerus is fractured, where radial nerve in the radial groove is injured, is what you need to remember. Once more, nice to see Dr. Lalit Shukla and many more who are all online. Good to see 9 online students in the morning. Always mornings are fresh. Mornings are energetic. We solve 100 questions every day as a test and have a discussion and start our day for preparation. Nothing like that. Next 100 days, you stay with me. I promise that I will make you the toppers in the NEET PG exam. You don't need to melt a mountain to become a topper in NEET PG. An ounce of perseverance, a pinch of confidence on yourself that you are born to become great. That is all that is needed to become the topper in the NEET PG. So 100 questions every day, 100 days is about 10,000 questions, most essential practice questions for you to crack the tomorrow's NEET PG, where there is a 100% strike rate. In the 200 out of 200 questions in tomorrow's NEET PG are going to come from these discussions. So inform all your friends, be part of this. There is also 1200 pages notes. Today only you order it. There are 50,000 high yield facts that you need to master, which is there in this 1200 pages notes. That's all. I'm there with you every day. Be part of the WhatsApp study group. A 45-year-old severe asthmatic, you're planning to draw the sample from the brachial artery. Where will you insert? Typically just medial to the biceps tendon. You have the brachial artery is what you have to basically remember. It lies superficial and just medial to the tendon of the biceps brachii in the cubital fossa is what you should remember. 23-year-old falls on the outstretched hand, a carpal bone is fractured. Scaphoid is the most common carpal bone to get fractured and in an outstretched hand fall, and that lead to tenderness in the anatomical snuff box is what you need to remember. You are examining patient's wrist and note a malalignment of one of the carpal bones. What is the most commonly dislocated carpal bone? Lunate is the most commonly dislocated carpal bone. Scaphoid is the most common fractured carpal bone. You have to be 100% sure for the tomorrow's exam. There's a severe tear in the medial collateral ligament of the wrist. Whenever the medial collateral ligament is injured, then which of the wrist movements become increased? So you should remember the medial or ulnar collateral ligament is the one which limits the abduction or radial deviation of the wrist. That is what you have to remember. 24-year-old slips, falls on the outstretched hand. Which structure transmits the force from radius to ulna? Between the radius and ulna, there is an interosseous membrane, which is the one which transmits the pressure, is what you need to understand. So, doctor, you solve it like a question paper. Once you solve it as a question paper, you will remember very easily. Because first you need to challenge your brain. Then the teacher comes and talks about it, you will remember it very easily. Okay? Now, you have done the MRI, identified the carpal tunnel. What is the most anterior structure in the anterior wall of the tunnel? It is the flexor retinaculum, which is the anterior boundary of the carpal tunnel. Now, there is a carpal tunnel syndrome. You identified median nerve. And what is the location of the median nerve in the carpal tunnel? You have the flexor carpi radialis tendon. Just medial to that flexor carpi radialis tendon, you have the median nerve is what you need to understand. Now, if the median nerve is severe, injured, what are the muscles supplied by the median nerve? It is the lumbricals. It is the lumbricals of the ring and little finger which are injured whenever there is any median nerve injury is what you need to remember. Because the lumbricals I mean, they are not injured, they are not weakened because lumbricals of the ring and little fingers are supplied by ulnar nerve, whereas the lumbricals of the index and middle fingers are by the median nerve. Abductor pollicis is by median nerve. Flexor pollicis brevis is by median nerve. That's what you need to basically remember. Now, there is a radiograph, articulation between upper limb and the trunk. So what is the joint which is most important joint to do that? It is the sternoclavicular joint, which is the one. Now, the main stability of the shoulder joint is because of which ligament, doctor? It is the rotator cuff muscles. Yes, ITS. Supraspinatus, infraspinatus, teres minor, subscapularis. They are the ones which are very important for maintaining the stability. Can the online students can punch? Is the voice loud and clear for all of you, doctor? Please punch. How is the voice for all of you? A college baseball pitcher has shoulder discomfort. There is a rotator cuff tear. So which muscle is often damaged in the rotator cuff tear? It is the supraspinatus, which is the most common muscle among the rotator cuff muscles which undergo the tear, the tendon of it, because the tendon of the supraspinatus is typically located between the head of the humerus and the acromion. Between the two, the tendon of supraspinatus is incarcerated. Patient has posterior dislocation of the hip. It is the ischiofemoral ligament. So, posterior dislocation will cause the tear of the ischiofemoral ligament, which reinforces the capsule of the hip posteriorly, is what you need to understand. Thank you, Alchman, Aishwarya Gupta, Rahul Sai, and many more who are all online. Excellent, doctor. Very nice to see Dr. Aishwarya Gupta, our DMO from TX Hospital, where I am the consultant critical care, emergency medicine and general medicine at TX Hospital on road number 12, Banjara Hills. All our duty medical officers, I invite you, you get a free coaching from Dr. Murli Bharadwaj. Every day, 100 questions we discuss. In 100 days, we mastered 10,000 questions. This is all that you need to become the topper in the upcoming NEETPG exam, doctor. 54-year-old man just dislocated the right hip. Physician is concerned about the integrity of the joint blood supply. Which artery is the main blood supply of hip joint? So remember, it is the medial circumflex femoral artery. So this kind of questions don't need any intelligence. You need to know the facts. There are 50,000 high-yield facts that you need to master. There is 1,200 pages notes I give you. The whole job is how fast you finish first revision, second revision, third revision of these 1,200 pages. 3 spiral bound notes I will give you. And I discussed these 1,200 pages, 50,000 high yield facts in 600 hours of video on the Score Learning app. I'll also give you the activation to this app when you join. So you get the notes, you get the videos, you get 100 question papers, daily 1 question paper discussion, 10,000 question bank. What else you need? You automatically become the topper if we all meet every day, if we all study together. Now, doctor, patient with hip dislocation is showing weakness of the extension of the thigh and hip. So, it is the tibial portion of the sciatic nerve. So, what is the most important extensor muscle of the hip joint, doctor? So, extensor muscle of the hip joint are hamstrings muscles. And they are innervated by the tibial portion of the sciatic nerve. That's what you need to remember. The gluteus maximus, it also can weakly extend the thigh at the hip, and it is innervated by the inferior gluteal nerve, is what you need to remember. Patient has sustained a external force on the knee. Which ligament prevent abduction of the leg at the knee joint? So you should know it's called as pivot shift test. So you should know all these tests, Lachman's test, pivot shift test, how to examine the knee joint instability. So abduction of the leg at the knee is limited by the medial or tibial collateral ligament is what you should remember. Now, which ligament prevents the posterior displacement of the tibia on the femur? It is the posterior cruciate ligament which prevents the posterior displacement of the tibia on the femur is what you should remember. There is a weakness in the ability to flex the knee. There is a problem. So the muscles which flex the knee joint, they are all innervated by the tibial part of the sciatic nerve is what we need to remember. Obturator nerve had been injured. So what is the function of obturator nerve? The medial compartment of the thigh, which adduct the thigh at the hip joint, they're all supplied by the obturator nerve is what you need to remember. A patient has a complaint of his inability to stand on the tiptoes. So if you want to stand on the tiptoes, you need to have the plantar flexors. They are located in the posterior compartment of the leg, which is innervated by the tibial nerve once more. Now, there is a difficulty to evert the foot at the ankle. Eversion of the foot is by the lateral compartment muscles of the leg, and they are all innervated by the superficial fibular nerve is what you need to remember. Very nice to see 14 online classmates. Excellent, doctor. So, रोज मिलेंगे रोज पढ़ेंगे एक दिन कामयाब होके दुनिया को बताएंगे भाई मेरा नंबर आ गया मैं टॉप रैंकर बन गया एंड मुझे पीडियाट्रिक्स ऑर्थोपेडिक्स जनरल मेडिसिन रेडियोलॉजी एक्सेट्रा में सीट आ गया मैं सर्जन बन गया सो वो ख्वाब देखना है डॉक्टर रोज सुबह उठते ही आप वो ख्वाब देखना वो ख्वाब देखते हुए सो जाना go to sleep with a dream wake up with a dream do daydream but ultimately get the seat that will come only next 100 days are crucial हम सब मिलेंगे हम सब पढ़ेंगे there are so many apps today so many video libraries so much of free content you are information overloaded today. Because of this information overload, you are not sure what to read, how to comprehend, how to consolidate. It is Dr. Murli Bharadwaj sitting with you here every day morning, holding your hand, giving you a plan of preparation to make you the winner and topper in the tomorrow's NEETPG. Very nice to see Dr. Swati Sai and many more who are all online, doctor. Every day morning 6 to 8. Even you have gone for a discotheque on the Friday evening, Saturday evening, or Sunday evening, even if you are on night duty in the hospital, don't forget every day, early morning, 6 a.m. to 8 a.m., you are with Dr. Murli Bharadwaj participating in test and discussion. 100 days, all 19 subjects covered according to a schedule. Today only take the schedule. Before coming to the class only, solve the question paper and come. Now, as an orthopedic surgeon, you are operating on the posterior compartment of the thigh. Posterior compartment of the thigh. So, You need to preserve the arterial blood supply of the muscle in the area. So what is the blood supply of the posterior compartment? Posterior compartment is by the perforating branches of the deep femoral artery. Profunda femoris is what you should remember. Now, the blood supply from the posterior tibial artery, it is to the calf and sole of the foot is also supplied by the posterior tibial artery. Now, in the DVT, what is the main deep vein of the leg which is affected? The anterior and posterior tibial veins are the ones which are affected. Greatest stability of the ankle joint. It is the talocrural or the ankle joint typically has the greatest stability when you do the dorsiflexion. One is plantiflexion, other is dorsiflexion ना. So dorsiflexion में maximum stability रहता है ankle joint को. That's what you need to remember. Medial deltoid ligament is being torn from its proximal attachment. So all the four components of the deltoid ligament, from where do they arise, doctor? Medial malleolus. Medial malleolus, where you find the tenderness, is what you need to remember. Patient is unable to walk on tiptoes. That means plantar flexion of the foot is affected. Plantar flexion is mainly caused and innervated. Plantar flexors are innervated by the tibial nerve. You have entered right pleural cavity, removed the lymph nodes at the hilum. Then these lymph nodes belong to which group of lymph nodes? So at the hilum, you have the bronchopulmonary lymph node group is located at the hilum of each lung, and it receives the blood flow from the superficial and deep lymphatic plexus. Now, one of the important blood supply you need to remember. What is that vein that crosses the midline from the left end, apparently emptying into the superior vena cava? So you should remember, it is the left brachiocephalic vein. Left, you can see the left brachiocephalic vein, which crosses the midline, and the right brachiocephalic vein is arising. The superior vena cava is continuing as a vertical right brachiocephalic vein into which the left brachiocephalic vein comes and drains, is what you need to remember. So the left brachiocephalic crosses the midline and unite with almost the vertical right brachiocephalic vein. Both of them merge into the superior vena cava, is what you need to remember. Very nice to see Dr. Azim Rizvi and many more who are all online. So solve the question paper, doctor. Then the test discussion looks very interesting. A pediatric heart surgeon divided the sternum in a child to repair a cardiac malformation. Can the online students once more punch? How is the voice? Is it loud and clear? Because I'm broadcasting this from the home. So please do punch and give me a feedback whether the voice is loud and clear for all of you. Hope the transmission is going smoothly. So generally it does. Yes. So the thymus, it is a lobulated gland-like structure which obscures the heart, is what you should remember. So what are the four anterior mediastinal masses, doctor? T, 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 and T. T for thymoma. T for terrible lymphoma. T for retrosternal thyroid. So you should not forget the four T's of the anterior mediastinum. So teratoma, thymoma, terrible lymphoma, and retrosternal thyroid, that is a goiter, these four present as anterior mediastinal lesions is what you should remember. Thank you, Rahul, Azim Rizvi, for the feedback that the voice is loud and clear. If you guys are from Hyderabad, even if 5 to 10 students इकट्ठा होके हम रोज 6 बजे को क्लासरूम को आएगा बोले तो मैं लाइव सेशन फेस टू फेस क्लास की कंडक्ट कर सकता हूं, राइट डॉक्टर? सो 45-year-old is noted to have 1.5 centimeter breast cancer. Which lymph node is affected? So medial breast drains into parasternal group of lymph nodes. Once more, breast and lymphatic supply is the favorite topic of the examiner, the high-yield topic you need to be very, very sure about. So there are supraclavicular group, this is the axillary vein, this is the latissimus dorsi, the breast drains into internal mammary, and also abdominal lymph nodes. And also you have the parasternal group of lymph nodes. Now, breast examination is being done. In addition to the breast tissue on the chest, where else you can find breast tissue? So the tail of the spens, it is located in the axillary area and it contains mammary tissue. 24-year-old woman vaginally delivered an infant, and there is a breast engorgement and swelling in the region above the level of the umbilicus and at lateral abdomen. So you should know that there are areas which are called accessory breast tissue. The milk line extends from the axilla all the way to the groin, and the accessory mammary tissue can be there anywhere along this line. There is a fatal trauma and there is a tear at the junction of SVC and right atrium. So the SA node, which is the pacemaker of the heart, it is in the right atrial wall, where the superior vena cava is joining the right atrial wall. This is the place where you find the SA node, is what you should remember. You want to examine AV bundle histologically. So where is the AV bundle? AV bundle is located in the membranous part of the interventricular septum. So interventricular septum has got a membranous part, muscular part, and ventricular septal defects can occur anywhere. There can be muscular defect, perimembranous defect. So it is the membranous part of the interventricular septum where the AV node is located, is what you should remember. Very good to see 16 online classmates. To all of you, Roz Subah 6 baje se 6 a.m. to 8 a.m. As a general medicine consultant, all my work starts 9 o'clock until midnight. Early morning, 1 a.m. I see the last patient. Emergency cases, OP cases, ward rounds, everything I finish in the morning. 9 a.m. to midnight, 1 a.m. Every day I see around 10 cases in the home, elderly geriatric patients traveling across Hyderabad because patients cannot come to hospital. Dr. Murali Bharadwaj goes to them to see them at the home. So still, I don't want to forget myself as a teacher, which I had been for the past 26 years, nearly gave coaching to 2 lakh medical students. Today, all the consultants in the hospital where I work, once upon a time were sitting like you as preparing for entrance. Today, they are urologists, nephrologists, cardiologists, rheumatologists, surgeons. So I enjoy practicing every day, discussing the clinical cases, admitting, discharging, treating, managing the cases with my own students once upon a time who were preparing for the entrance exam. So some of you also will become one day my colleagues and consultants, co-consultants. So study with the dream that एक दिन हमारा नंबर भी आएगा. provided you need to believe in yourself, doctor. Nobody else will believe in you. Daddy doesn't believe, mummy doesn't believe. They all believing, your girlfriend, your boyfriend believing you is all last thing. First, you need to believe. भाई मैं रोज डॉक्टर मुरली भरद्वाज सर के साथ बैठ के मैं पढ़ूंगा, 100 into 100 क्वेश्चन पेपर सॉल्व करूंगा, 10,000 MCQs प्रैक्टिस करूंगा और मुझे जरूर नीट पीजी में टॉप 1000 रैंक्स में मिलेगा. मैं 1200 पेजेस में 50,000 हाई यील्ड फैक्ट्स को मास्टर करूंगा. That is what you need to have. First, confidence in yourself, perseverance, persistence. Don't tell preparation is boring, Abba, I'm reading, I'm forgetting, Abba, what can I do for it? Nothing you can do about it. Just you need to get focused. Every coaching center will say, I give 800 hours, I give 1000 hours video, I give you 5,000 pages or 10,000 pages notes. Oh, sab bakwas hai. You don't need all that. You just need 50,000 high yield facts, which I created as 1200 pages notes. Master it. Topics like Bartter syndrome, Gentleman syndrome, Liddle syndrome, renal tubular acidosis, glomerulonephritis, apoptosis. Any number of times you read, they will evaporate, but you need to master. Right? Few facts about each of it you need to master, like complement, component, pathway, etc. You need to master. And you need to practice at least 100 questions with me every day. I'll give it as a PDF and also as a question paper online and also on the Score Learning app. Practice it, come to the discussion, learn, get inspired, and then entire day is available for you to do the quick revision of the notes, right? So, doctor, 57-year-old man develops myocardial infarction, heartbeat is 40 beats, right coronary artery supplies the AV node. So, whenever there is any inferior wall MI, what are the ECG leads where you see inferior wall MI, doctor? 2, 3, AVF are the leads which are looking down, where you see the inferior wall MI is what you need to remember. So, how do you identify the right pulmonary artery? So, right pulmonary artery, it is posterior to the ascending aorta. So, ascending aorta and the IVC, SVC. उसके पीछे रहता है राइट पल्मोनरी आर्टरी. राइट पल्मोनरी आर्टरी कहाँ है? अयोर्टा और आईवीसी के पीछे क्या है? राइट पल्मोनरी आर्टरी. So now, how many pulmonary veins enter the left atrium? So 4 pulmonary veins that carry oxygenated blood drain into the left atrium is what you should remember. 44-year-old has DVT, became hypotensive, that means pulmonary embolism has developed, and there is a saddle embolus, saddle-shaped embolus. Which saddle? Saddle मालूम है ना? Horse के ऊपर ride करने वाले का. So saddle embolus is the one which is typically responsible for pulmonary embolism. Now, you want to aspirate while doing thoracocentesis over the top of the rib. So, which intercostal space inferior to the lower border of the lung in the MAL, mid-axillary line, at the end of the normal expiration? So, what is the highest level at which this procedure can be safely done without injuring the lung, doctor? 8th intercostal space in the mid-axillary line. In the mid-axillary line, 8th intercostal space is the point where the lung is ending and you have the pleura. Anything above that, if you put the needle into the intercostal space, then you are definitely sure shot to injure the lung very much, is what you need to remember. Once more, what are the surface landmarks for the lung during various phases of inspiration, expiration? In the mid-clavicular, mid-axillary line, you need to be very sure. The lowest level of the pleural cavity in the mid-axillary line lies at the level of the 10th rib is what you need to remember. Similarly, the lower part of the lung at the mid-clavicular level will be there at the 6th rib is what you need to remember. So all these surface markings, anatomically the surface markings you need to remember, doctor. Very happy to see 19 online classmates. Very good. आओ हम सब मिलेंगे मिलके पढ़ाई करेंगे रोज 100 क्वेश्चंस क्वेश्चन पेपर 100 days there is a schedule which subject test paper every day and this is made available as an online test before only. So today only subscribe, take the test, and every day early morning 6 a.m. to 8 a.m. with a coffee cup, chai pe chircha with Dr. Murli Bharadwaj. Then the entire day we become busy with patients, emergencies, cardiac arrests, pulmonary edemas, and flaring up COPD, bronchial asthmas, buzz sounds of the intensive care unit. We're all running as residents and consultants. But morning, 6 to 8, every day, Dr. Murli Bharadwaj conducts a 100 MCQ question paper. Next 100 days में 10,000 sure short questions. ये 10,000 काफी है. There is no other practice required from which comes 200 questions in the tomorrow's NEETPG exam. As a cardiologist, there is a blockage of an artery that is going to the SA node. So the SA node or AV node, both of them, they are supplied by what? Right coronary artery. Right coronary artery also supplies inferior wall of the heart. That's the reason inferior wall MI and the AV nodal block are both associated patient presents with bradycardia, cardiac block, heart block, whenever the inferior wall MI is there. Now, majority of the interventricular septum, it gets the blood supply from anterior interventricular artery. Anterior, 2/3 of the interventricular septum is supplied by the AV artery, and the right and left bundle branches of the conduction system are supplied by the anterior interventricular artery is what you need to remember. Now, doctor, you are worried about the blockage of the artery to the AV node in the patient. AV node is supplied by right coronary artery. Now, a very interesting question. The main course of the intercostal vessels and nerves, they all go deep to the internal abdominal oblique muscle. There is a neurovascular plane through which they pass is what you need to remember. You are doing appendicectomy. You encounter an artery and vein in the superficial fascia of the lower abdominal wall. So the superficial epigastric vessels, they all lie within the superficial fascia. You want to incise the anterior rectus sheath between the xiphoid process of the sternum and the umbilicus, between the two. So in this area between the umbilicus and the xiphoid process, the rectus sheath is derived from where? It is derived from the external and internal abdominal oblique muscle is what you need to remember. So you should know the superior 3/4 of the anterior rectus sheath is derived from the epineuritis of the external and internal abdominal oblique muscles is what you need to remember. During a laparoscopic surgery, you observe the inferior epigastric vessels ascending on the posterior surface of the rectus abdominis muscle. They suddenly disappear from view by passing superior to what? By passing superior to arcuate line. So, rectus sheath above the costal margin, rectus sheath from costal margin to midway between umbilicus and symphysis pubis, and rectus sheath between the midpoint of the umbilicus and the pubic symphysis. You need to know the composition of the rectus sheath. As the inferior epigastric vessels ascend on the posterior surface of the rectus abdominis, they pass superiorly to the arcuate line anteriorly to the posterior rectus sheath is what you need to remember. Now, the inguinal ligament, it is derived from the aponeurosis of external abdominal oblique muscle. Inguinal ligament, easy question. Now, superficial inguinal ring, it is also the part of the aponeurosis of the external abdominal oblique muscle. Direct and indirect inguinal hernia and the anatomy of the inguinal canal, you have to be 100% sure, doctor, when you go to the tomorrow's NEETPG exam. So you should know that the direct inguinal hernias occur through the inguinal triangle of Hasselbalch, and the inferior epigastric vessels, they form the lateral boundary of the triangle. That's the reason for the direct inguinal hernia which comes to the Hasselbalch triangle, the inguinal vessels are all lateral to the hernia, is what you need to remember. So in the direct inguinal hernia, the epigastric vessels are lateral to the herniation happening through the Hasselbalch triangle. That's the point you need to remember. Now, if you want to know the gallbladder, what is the correct landmark to know the normal position of the gallbladder? It is the right linea cevilunaris and the subcostal margin junction hota hai na, doctor. That is the place where you identify the gallbladder. So palpation of the gallbladder is very important. If there is any acute cholecystitis, whenever the patient takes a deep inspiration and the gallbladder is descending down, that inflamed gallbladder touch your hand, the patient will hold his breath. So that's called Murphy's sign in the case of the acute cholecystitis. You remove the gallbladder, cystic artery is the blood supply. From where does it arise? The cystic artery is the branch of the right hepatic artery. You have placed the finger on the epiploic foramen. What is inferior to the epiploic foramen? It is the first part of the duodenum. So this is the gallbladder. This is the foramen of Winslow, the epiploic foramen. Stomach just became the first part of duodenum. First part of duodenum is inferior to epiploic foramen is what you need to remember. So everything, anything about the boundaries of the epiploic foramen. Superiorly caudate process of the liver. Posteriorly is inferior vena cava. Inferiorly the first part of the duodenum. Anterior to the epiploic foramen is the free margin of the lesser omentum. And what does it contain? The triad. Hepatic artery, bile duct, portal vein are there within the lesser omentum, free margin of the lesser omentum, which is anterior to the epiploic foramen, is what you need to remember. You have elevated the transverse colon, identified artery in the transverse mesocolon. What is this vessel, doctor? It is the middle colic artery. The middle colic artery courses to the transverse mesocolon, and ultimately what does middle colic artery supply? The middle colic artery is the one which supplies the transverse colon, and it passes through the transverse mesocolon, is what you need to remember. There is a retroperitoneal artery is going, retroperitoneal supplying the ascending colon. So all of you know, transverse colon is intraperitoneal, but ascending and descending colon are both retro. So that is the reason the retroperitoneally right colic artery passes retroperitoneally and supplies the ascending colon, is what you need to remember. So all these are the finest questions, doctor. Sure shot to come in the tomorrow's NEETPG. Nice to see Wandering Surgeon, Azim Rizvi, Swati, Aishwarya Gupta, everybody who are all online. So please come every day, morning 6 to 8. Tell all your friends also to come. Today only subscribe to our 100 grand test program, subject-wise test program. In the next 100 days crash course, I'll every day discuss 100 questions and 10,000 questions in the next 100 days, from which 200 questions, 100% strike rate to come in the tomorrow's NEETPG. Along with that, you also will be provided when you subscribe with 1200 pages notes, activation to the Score Learning app, both iOS and Android is there. Now, the right colic artery supplies the ascending colon, which is retroperitoneal. You are cannulating and embolize the artery which is supplying the ulcer, which is in the proximal duodenum. So what is that which is supplying that? The superior pancreatico-duodenal artery, which is supplying the duodenal ulcer. It is a terminal branch arising from the celiac artery. So the gastroduodenal artery, anterior pancreatico-duodenal artery, posterior pancreatico-duodenal, inferior pancreatico-duodenal, they're all called pancreatico-duodenal arcade. So they are the terminal branches of the celiac artery is what you have to remember. So all these common hepatic artery branches, celiac artery branches, from where left gastric artery comes, from where right gastric artery comes, everything you have to be 100% sure, doctor. I discussed all this, provided in the 1200 pages high yield facts notes to you. Today only mastered it. Now, appendix is not visible. You should know, in about 66%, appendix is retrocecal in position, most common location. How do you locate the appendix? The three tinea coli converge at the base of the appendix. So the colonic wall shows tinea is one important feature, tinea, and appendices epiploicae. They are the classical features of the colonic wall is what you should remember. There's an infraumbilical pain. So typically the hindgut structures, foregut, midgut, hindgut derived structures lead to pain below the umbilicus. So sigmoid colon, infraumbilical pain is what you typically see. You are mobilizing the second part of the duodenum and the head of the pancreas. There's an artery and vein passing anterior to the uncinate process of the pancreas. Anterior to the uncinate process of the pancreas and third part of the duodenum. What are they? So you should know the superior mesenteric artery and vein. They pass anterior to the uncinate process. You know, this is the pancreas. Pancreas has uncinate process. And here you are having the duodenum. They both are passing anterior and superior to the uncinate process and the duodenum. The superior mesenteric vein and the superior mesenteric artery is what you have to emphatically remember. Once more, Rahul, Azim, Swati, Aishwarya, can you please punch? Is the voice loud and clear for all of you, doctor? Can you please kindly punch so that I am reassured that the broadcast is smooth? Now, you elevated the duodenum and pancreas. There are two veins posterior to the neck of the pancreas uniting to form a large vein. So what is that large vein, doctor? It is a portal vein. The portal vein, how is it formed? It is the splenic vein and the superior mesenteric vein. They two merge together to form the portal vein, which passes posterior to the neck of the pancreas, is what you should remember. Thank you, Azim, Rizvi, Aishwarya, Rahul, for the feedback that the voice is loud and clear for all of you. Very good, very good. So a lot of times students say, shall we only prepare for entrance or shall we do the night duties and work? Always remember, if you sit alone, you will get decubitus ulcers preparing for entrance exam. Nothing more than that. But 4 to 5 hours or 6 hours, you are working. You are doing writing discharges. You are working with patients. You are talking to patients. You are clinical. Then life looks interesting, right? Then maximum 4 or 5 hours is what all that you need to prepare, doctor. You don't need a full day to burn your energy. If you are focused, if you know what to do, what to revise for the exam, if you logically prepare with Dr. Murli Bharadwaj, you don't need 4 to 5 hours a day. And every day start your day with a couple of hours of live discussion. That's all that you need to become a topper. Large tortuous artery passing to the left along the superior border of the pancreas. The most tortuous artery in the body is splenic artery. It is located along the superior border of the pancreas as it is passing to the left towards the spleen is what you need to remember. You're examining the liver. Between which two lobes is the gallbladder located? So don't forget, Covenant's classification of the liver segments, you should not forget, doctor. So, right lobe and quadrate lobe, ये दोनों के बीच में right lobe of the liver and the quadrate lobe, you are having the gallbladder is what you should remember. Where is gallbladder? Right lobe and the quadrate lobe. Between, this is the quadrate lobe, this is the right lobe. Between the two, you are having the gallbladder. If you ligate the right hepatic artery, the arterial supply to which part of the liver will still remain intact. So you only ligated right hepatic artery, left hepatic artery is still there. So left hepatic artery supplies left lobe and quadrate lobes and a part of the caudate lobe. They are supplied by the left hepatic artery. So you need to be very sure about the Covenant's classification, different lobes. So this is the caudate lobe. This is the left lobe. This is the right lobe. In that you have the renal impression, colic impression, duodenal impression in the right lobe. Then you have the round ligament, the quadrate lobe of the liver. This is the caudate lobe. Inferior vena cava is passing very close to the caudate lobe. All other lobes drain into hepatic vein. Hepatic vein drains into inferior vena cava. Only caudate lobe is the only one which directly drains into inferior vena cava. That's the reason whenever hepatic vein occlusion is there, then all other lobes need to come to caudate lobe and say, Ayyo, our hepatic vein is blocked, we can't drain a caudate lobe. We will all pass through your garden to drain into inferior vena cava. That's the reason caudate lobe become hypertrophied. Isolated caudate lobe hypertrophy hai to, that means all other lobes are unable to drain into hepatic vein due to hepatic vein thrombus. They all need to come to caudate lobe, and through caudate lobe they are draining into IVC. So that means hepatic vein thrombosis is reflected as caudate lobe hypertrophy. If you do the ultrasound, this is what you need to remember. Your patient has cirrhosis, esophageal varices. Now, that lead to, whenever there's a portal hypertension, then what will happen? Left gastric and hemiazygous. So esophageal veins, where do they drain, doctor? They drain into left gastric vein and to the hemiazygous vein. They are the two main blood vessels, the veins into which the esophageal venous drainage happen. So esophagus, everything you should know. Venous drainage, arterial supply, and the lymphatic drainage, 200% you should know, doctor. Make a note now only, right? Now, gastric contents which are exiting a posterior perforation of the stomach, where will they accumulate? So you should know there is a lesser sac which is also called omental bursa. It is posterior to the stomach. So it is the stomach, this is the omental bursa. Any posterior perforation will cause the collection of the fluid within the lesser omentum, otherwise called omental bursa, is what lesser sac, which is called omental bursa. The ligation of the common hepatic artery, what will it lead to? So you should know that the blood flow through the right gastro-omental arteries will be lost, if you like it, common hepatic artery, because common hepatic artery is the origin for right gastric and right gastromental arteries is what you should remember. So the fundus of the stomach, what is the blood supply? It is the short gastric arteries, the short gastric arteries would supply the fundus of the stomach. So everything about the stomach, the greater curvature is supplied by left gastroepiploid, the lesser curvature is supplied by the right gastric artery, and the fundus of the stomach is supplied by the short gastric artery. You have to be very sure, doctor, about the blood supply of the stomach, one of the favorite areas for the examiner. So anatomy is very tricky. Don't try to become obsessive, compulsive that I need to master anatomy. Impossible. There are totally 2000 high-yield facts in anatomy, from which those 5 to 6 questions come. So these 2000 high-yield facts I gave in around 25 pages notes. In the 1200 pages notes I gave. But just try to master these 25 pages notes, 2000 high-yield facts in anatomy. You get working knowledge to answer. Out of these 5 to 6 questions, at least 4 questions you can easily answer if you master these 2000 high-yield facts in the 1200 pages notes I give you, doctor. During the removal of the patient's kidney, which structure is most anterior to the renal sinus? It is the renal vein. So here you have the renal sinus. Some of the residents who are attending right now, you are all working in TX hospital, where I am the consultant in critical care and emergency medicine. Day in and day out, we do the renal transplants. So you should know the relationship. Renal vein is anterior to the renal sinus is what you need to remember. You want to examine the hilum of the right kidney during surgery. Which structure you need to elevate? The duodenum lies immediately anterior to the hilum of the right kidney. So this is the right kidney. The hilum of the right kidney, immediately anterior to that you have the duodenum. Duodenum को उठाओ और उसके नीचे रहेगा hilum of the right kidney. Similarly, to elevate the kidney within the renal fascia and the perirenal fat, the renal fascia must be reflected. So the renal fascia is fused posteriorly with the fascia of the psoas muscle. So this is the right kidney, renal fascia. Renal fascia and the psoas sheath, they both are fused with each other, is what you should remember. So some of you are going to be top urologists in the times ahead, and one day you will be doing kidney transplants. Fastest kidney, remove it and put the donor kidney. You'll be the fastest urologist. That day I will remember. Now, as a surgeon, you are about to remove the right adrenal. So what is the blood supply? So you should remember the central vein of the right suprarenal gland drains into IVC, whereas the left suprarenal, that is the adrenal gland, left side will drain into left renal vein, whereas right side drains into IVC directly. That is the difference between the two. Now, which structures receive lymph directly from the stomach? So you should know lymph nodes typically are located along with the several arteries that supply the stomach. All of them will drain into the celiac group of the lymph nodes. And all the arteries that supply the stomach are all the branches of celiac artery is what you should remember. Patient has testicular cancer that metastasizes to the lymph nodes. So where will it go first? It will go to the lumbar nodes, aortic nodes. That's what you need to remember. The tumor cells of the gonads metastasize to the lymphatics and metastasize to the lumbar group of lymph nodes. So everything about the blood lymphatic drainage, because testicular cancer is a hot topic for the examiner. Surgical anatomy of the testis is a favorite question. There's a boil on the right labia majora. The primary drainage of the vulva is to the superficial inguinal lymph nodes. Perineum is divided into urogenital triangle and the anal triangle by a line which is passing between the two ischial tuberosities, is what you should remember. A 24-year-old undergoing vaginal delivery, midline episiotomy is performed. It is incising perineal body. Now, what are the structures that are attached to the perineal body? Once more, doctor. Superficial perineal pouch, deep perineal pouch, perineal body. All this anatomy you need to master. Bulbous spongiosis, superficial and deep, transverse perineal, and external anal sphincter. They are all the muscles attached to the perineal body. Female clitoris is equal to male penis. Now the scrotum is pigmented, wrinkled, all because of the dartos fascia, which gives that wrinkled appearance to the human dartos, the scrotum. 18-year-old has testicular cancer. What is that layer that surgeon incised to reach the testicular parenchyma? It is the tunica albuginea. It is a thick capsule which is surrounding each testis, is what you need to remember. It is like the Rajgarh and Pratapgarh fort of Shivaji, like the wall, albugenia, tunica albugenia is surrounding the testis. 31-year-old, you have done pelvic examination. Uterine body is tipped toward rectum and the uterine fundus is tipped anteriorly. What do you call it as? It's called retroverted and antiflexed. So what is version? Version is the angle between the longitudinal axis of the cervix and that of the vagina. Flexion is the angle between the longitudinal axis of the uterus and the cervix. So you have to be very sure. Version is the relation between uterus and vagina. Flexion is the relation between the body of the uterus and the cervix. You need to be very clear. So what is the meaning of retroversion, antiversion, antiflexion, retroflexion? You have to be 100% sure. 45-year-old has uterine bleeding from uterine fibroids. So how does uterine arteries travel? They travel through the transverse cervical ligaments, which are called cardinal ligaments, through which uterine arteries travel. So remember, when uterine artery is going, ureter is passing underneath it. Wife is gynecologist, husband is urologist. Why a good combination? Because if the wife injures ureter, at least husband will come and rescue the ureter, being a urologist. That's the only reason. A spinal lead is placed through vagina to know how is the blood sup, whether there is a blood in peritoneal cavity. What is the most dependent part of the peritoneum? It is the recto-uterine, between the rectum and uterus. Rectum, between the rectum and the uterus. You have the recto-uterine pouch, which is called the pouch of Douglas, through which you do kuldocentesis, which is the most dependent part of the pelvis. Now there is a ectopic pregnancy involving ampulla. How do you like to call ampulla? Ampulla is that part which begins to widen distally and is the longest portion of the fallopian tube. Bilateral oophorectomy is performed. The ovarian arteries are ligated. So how do you like to describe ovarian arteries? So you should know the right ovarian vein drains into IVC, left ovarian vein drains into left renal vein. Same thing is with testicular vein. Right testicular vein drains into IVC, left testicular vein drains into left renal vein. That's the reason whenever left varicocele is there, rapidly developing, you should suspect the possibility of any renal cell carcinoma, any obstruction to the renal vein. You should always suspect it whenever left-sided varicocele is rapidly developing, because the drainage is impaired. So a 3 centimeter ectopic pregnancy of the isthmus of the left tube is ruptured. So where do you see the blood? The uterine artery and the ovarian artery, they both anastomose. They provide the blood supply within the mesosalpinx of the fallopian tube, is what you need to remember. 66-year-old has BPH. So typically, it is the middle lobe of the prostate through which the urethra traverses, and it is obstructed in the BPH. Through the middle lobe, it will be passing. So all the lobes of the prostate, BPH, prostate carcinoma, one of the favorite areas. You pass at the cystoscope in the urethra through penile portion. So the longest part of the urethra is the penile urethra, and it traverses through the corpus spongiosum. Penile urethra is the longest part. Here you have the membranous urethra. Then you are having the prostate gland. So you need to be very sure on all these structures of the male reproductive system, urethra, how that passes. And you can see the bladder drains. This is the point of confluence of the semen and the urine together, ultimately pass to the urethra at the time of ejaculation. Now, alkaline phosphatase. So what is the source of alkaline phosphatase in the semen? It is seminal vesicles. The source of alkaline phosphatase. Alkalinity helps to neutralize the acidity of the vagina. So madam is acidic, sir is alkaline. So unless the two mix, neutrality will not come. Sperm cannot swim. CT scan depicts the abdominal portion of the ureter lying anterior to which muscle? So abdominal ureter lies anterior to the psoas muscle. The ureter relationships, you need to be very, very sure about, doctor. Now, typically the blood supply to the ureter don't have any specific artery, doctor. All the small branches from the nearby arteries supply the ureter along its length. So that is one thing about the ureter that you need to know. There is no specific artery for the ureter. Now, 30-year-old woman has an absent kidney. So you should know that urinary and paramesonephric ducts are very close proximity, embryologically related. So any abnormality of the urinary system lead to genital system abnormality of all those structures arising from the paramesonephric ducts. That's the reason ipsilateral fallopian tube, uterine horn, or cervix, any of them can be abnormal. Whereas distal vagina, vulva, ovary, they are not from the paramesonephric duct. So that's the reason they won't get affected whenever there is any abnormality in urinary system. They won't get affected. So simply asking, what are the derivatives of paramesonephric duct? So fallopian tube, uterine horn, cervix, they are all derivatives, not distal vagina, vulva, or ovary from paramesonephric duct. Now, the last two questions before we close this session, doctor, our successful first subject test we are finishing. Thanks for being part of this wonderful communion. रोज मिलेंगे रोज पढ़ेंगे एक दिन कामयाब होंगे और बोलेंगे दुनिया को मेरा नंबर आ गया मैं नीट पीजी का टॉपर बन गया and I am going to join the beautiful MD General Medicine, MS General Surgery, MD Gynecology Obstetrics government seat. Wow, getting stipend, treating people. Your dream branch, only that should be visible to you. Nothing else, no alibis are permitted. So when you are doing a lumbar puncture, how does your needle pass, doctor? Skin, supraspinous ligament, interspinous ligament, dura mater, then you enter into subarachnoid space. 45-year-old, shooting pain, and lateral thigh. Typically, lateral thigh is supplied by what? It is supplied by L2 and L3. L2 and L3 areas are the ones which supply the lateral thigh, is what you need to understand. So once more, doctor, Thank you very much for being the part of the today's early morning. The day is long, the day is fresh, the day is energetic. No regrets, no guilt. Pado, 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 pado. No tension, no anxiety. They're all artificial feelings. There's nothing to feel artificial. If you feel depressed, if you feel tension, if you feel anxiety, if you feel insecure, we get dementia. Pseudo dementia means depression. Don't get that. Whenever you get tension, jao, calm karo, dawkhane mein, hospital mein. That's how you need to keep in high energy, high spirits. 1200 pages notes. Today only you order. When you subscribe, we will courier to your home and you become the topper in the exam. Good luck and enjoy the preparation. Enjoy the journey.